Hi everyone, and welcome to week 8. I am going to give a brief introduction of what we'll be doing this week. This week we'll be learning about cardiovascular disease, which correlates with chapter 10 in your textbook. The objectives we'll be covering this week are talking about the different types of cardiovascular disease. We will identify risk factors for cardiovascular disease and also talk about the protective factors for cardiovascular disease. This week's activities will include reading chapter 10, viewing the chapter 8 or week 8 PowerPoint. I have a heart risk calculator, a link that brings you to a website to allow you to determine what is your risk of cardiovascular disease. And then I have a video titled A Little Heart Attack. The assignments you'll be turning in this week include rolling the dice assignment, risk or protective factor assignment, your chapter 10 quiz, of course your discussion board, and then this week we have a journal assignment. The rolling the dice assignment is really there to help you get a better understanding of the different risk factors associated with cardiovascular disease. Because I realize you may not have dice to work with, I have provided a link which brings you to a random dice generator. Let me pull that up here, and it looks like this. So if you're rolling one dice, you would just click on one, roll dice, and then there's what you rolled. You can roll again, or you can go back and change the dice to 2. I just really wanted to go over this assignment with you briefly. So the assignment goes through the life stages, so choices as a teenager, as an adult, and then as a senior citizen. And what you're going to do is follow the directions. So for the choice as a teenager, you roll the dice. So let's roll the dice really quick just to show you what this looks like. It's just one die, and I get a 4. So going back to the worksheet, I get a 4, which means I eat some high-fat fast food, and I would give myself points for that. So for this, it would be 4 points. I roll the dice again to see, am I couch potato? Do I get exercise? Whatever I get. For this, if I rolled a 1, my life is pretty stress-free. I would subtract 10. If I rolled a 6, I have a lot of stress. You add 10. For any numbers between, so 2, 3, and 4, and 5, it would be 0 points. And then here you have this. So you would continue to do this for, sorry, I missed right here. If I got 3 or 4, my points would be 5. This is where you see the points. I would continue to fill out this worksheet, and then I just add the choices. As your numbers get higher, you have a greater risk of a heart attack. And then here you will recalculate the choices and answer the questions based on that worksheet. The next assignment is risk or protective factor. And so for this, what you're going to be doing is just reading each statement, make a plus sign if it's a protective factor, and a minus sign if it's a risk factor. Excuse me. Moving on. The other assignment we have this week is our journal assignment. This week is halfway through the course, and I want you just to reflect on your experience in this course. So what is your current grade? Does it reflect the effort you have placed in the course? Are there any aspects in this course that are confusing or difficult for you? Why? Oops, sorry. As we move forward, how will you continue to be successful in this course? And then lastly, is there anything else you would like to share with me? Is there anything I can do as your instructor to help you be successful in this course? If you recall, The journal communication is just between you and I. No other students have access to that communication, so feel free to be honest. So this week we're talking about cardiovascular disease, and I want to start this off with a case study. A 42-year-old woman calls her doctor complaining about chest pain brought on by moderate exercise. After 10 or 15 minutes, the pain would go away. The recurrence of this pain became more frequent. The doctor told her to go to the ER. At the emergency room, she was given a cholesterol test, which results showed was elevated, and told the doctors that her brother died of cardiovascular disease at the age of 25. The doctor told her if she kept worrying about her cholesterol, she was going to give herself a heart attack and sent her home. The woman went to a different doctor who found that she had significant blockage in the blood vessel leading to her heart and underwent a successful angioplasty treatment. When we look at cardiovascular disease, it is the greatest cause of in the United States, and this includes heart disease and cerebrovascular disease, which are strokes. Cancer also is one of the greatest leading causes of death in the United States, and it can affect any area. In women, however, it's most likely to affect the breast, lungs, reproductive system, and skin. We look at the epidemiology of cardiovascular disease. Almost 500,000 women die annually of cardiovascular disease. If all forms of cardiovascular disease were eliminated, life expectancy would increase by 7 years. Of the various forms of cardiovascular disease, coronary heart disease is the leading killer, killing nearly 480,000 people. Stroke kills over 150,000 people each year, so it's about 1 in 5 of cardiovascular disease deaths. And 60% of stroke deaths are women, so you see some disparities here. We look at the economic costs of cardiovascular disease. When we look at direct costs, these include health expenditures, hospital nursing home services, medications, and home health care. When we look at indirect costs, this could be loss of productivity, meaning I can't work anymore because of my cardiovascular disease, or my caregiver, my husband now has to take care of me, so he cannot work. That would be considered an indirect cost. So coronary heart disease is when the coronary arteries become blocked or narrowed with plaque. The clots forming in an artery can also lead to blockage, meaning blood flow cannot go through. This is what can lead to a heart attack. So coronary arteries are the blood vessels that provide oxygen and blood to the heart. So it's what feeds the heart essentially. So if we think about it, if plaque causes cardiovascular disease or CHD, what causes the plaque? So it begins with a buildup inside the lining of the coronary artery and begins with LDL cholesterol moving inside the arteries. So LDL cholesterol is that bad cholesterol, the cholesterol you really want to make sure your numbers are low. In addition, some white blood cells also get stuck within this lining and die, which also forms a blockage. It can grow until it takes up about 95% of the space in an artery. So you can see here the images. You have, it starts here with some damaged endothelium cells. Then these fatty deposits and LDL begin to sort of build up. And here you can see the continual buildup. And here you can see there's significant blockage of an artery. Other forms of heart disease include congestive heart failure. These are when weakened heart muscles can't perform the pumping function with proper vigor or enough strength. It's often a disease of older women who have already previously suffered from some heart damage. Arrhythmias are problems with heartbeat. So arrhythmias can be too fast, your heart beats too fast, it could be too slow, or irregular. So sometimes it's fast and sometimes it is slow. Rheumatic heart disease results from a bacterial infection with the strep bacteria. It can cause damage to heart valves. However, it is curable with antibiotics. And then angina pectoris is basically a heart attack. So it's when you have chest pain resulting from an insufficient supply of blood to the heart muscle. It's considered disease of the extremities, your arms and legs, in which blood supply is diminished, resulting in lack of nutrients and oxygen to those areas. Metabolic system is a group of diseases that occur together and is a huge risk factor for cardiovascular disease. So metabolic syndrome include having an elevated waist circumference. So it's having a waist circumference, your waist is larger than your hips, having high lipid levels. So that would be the LDL levels of your cholesterol, high fat levels, having low HDL levels. Now, HDLs are good cholesterol. This cholesterol will actually go in and sort of sweep out the bad cholesterol from our arteries, so it helps keep our arteries clear. Having high blood cholesterol and having an elevated fasting blood glucose level, which can also be an indicator of being pre-diabetic or diabetes. Metabolic syndrome tends to be a greater risk for women than for men, meaning if a woman and a man both had metabolic syndrome, it's actually more risky for a woman because it's more closely associated with cardiovascular disease. When we look at cerebrovascular diseases, these are also known as strokes. Now, whereas in cardiovascular disease, you see the coronary arteries being damaged and the blood going to the heart is reduced. So this is similar, except that the blood going to the brain now is reduced. And so what happens is portions of the brain are unable to receive the oxygen and nutrients they need and then begins dying. Survivors of cerebrovascular disease often have a long recovery in front of them. Many things have to be learned if those areas of the brain were damaged. There are different types of strokes that can occur. There's the ischemic stroke, which is the most common type of stroke, and it's caused by a cerebral thrombus or embolism. And so here you see a thrombus where the blood vessel is blocked, and here is an embolism. You can see this is a clot. And an aneurysm is when this clot here has ruptured. So there is bleeding in the brain, essentially. When we look at recovery from the strokes, the good news is that 50 to 70% of survivors will regain functional independence, meaning they can live independent lifestyles. 15 to 30% are permanently disabled, and that varies between different people and how severe the event was. 20% require institutional care within 3 months after the initial stroke, and 25% of women with a stroke die within a year. In addition to that, risk of death and future strokes also increases with age. When we look at rehabilitation, it really depends on what area of the brain was affected. So you may need to work with a physical therapist or a speech therapist, mental health, or other professionals. That really just depends on where the area of the brain where the stroke occurred. So it's now suggested women are placed into a category by their physician regarding their treatment area. So you're either at high risk for a cardiovascular event, at risk, or at optimal risk, which is really where you want to be, meaning your chances are the lowest at optimal risk. So there are some significant genders when we think about cardiovascular disease. So before menopause, so younger women, women's hormones protect them from cardiovascular disease. However, after menopause occurs, their risk goes up because those hormones are no longer a protective factor. With women, the symptoms and signs of heart attack are very different. So women tend to have fewer symptoms, and their symptoms tend to be quieter. So they have less sharp, intense pains. They tend to have shortness of breath and have a cold sweat. They're nauseous, they're dizzy. And so as you can tell from the video this week, I had a little heart attack, those are more traditional signs for women. Before they actually started studying differences between women and men in symptoms of cardiovascular disease, the assumption was that the men's symptoms were universal. And so everyone who had those were symptoms to look for a cardiovascular event. However, as research progressed, and they discovered that women's symptoms are vastly different from men's symptoms. And so this has changed the look of signs and symptoms for cardiovascular disease because a physician now has to take into account the gender of their patients. And lastly, women are more likely to die from heart attacks compared to men. So other facts. Here's another case study for you. There was an Olympian champion dance team. They were called Ekaterina Gordieva and Sergei Grigov. They were young Russian figure skaters and had won 2 Olympic gold medals in the pairs competition, and were expected to continue to dazzle audiences and judges for years in the future. However, in November 1995, 28-year-old Sergei suddenly collapsed and died during a practice session. He was a non-smoker, obviously very physically fit. His diet was good, and there had been no warning signs. So think about what happened to cause this young athlete's early death if there were no risk factors, no warning signs. What could have happened? So here are the facts. So Sergei was born with a mutation called PLA2 in a single gene that affected the formation of blood clots in his body. This mutation caused clots to form in the wrong place at the wrong time. And if such a clot forms in the arteries that supplies the heart or a coronary artery, a heart attack can ensure. And so not only when we think about cardiovascular disease, we have to think about lifestyle factors. We also have to think about genetic factors. And so what are in our genes that may also place us at a higher risk for cardiovascular disease. That is why when you go to doctors, oftentimes they'll ask you for your health history, because this can give us a clue if there is some genetic component to a heart disease or any sort of health problem. So if you recall back to the first case study where our woman went to the doctor complaining of chest pain while moderate exercise, her brother had died from a cardiovascular disease at the age of 25. That would indicate that there is some sort of gene mutation or genetic factor that places her at a higher risk for cardiovascular disease. Well, this concludes our PowerPoint and our lecture for week 8. Have a wonderful week.